My bad. My, I have to call telehealth. Hello?
Yes, may I ask who's talking? May I ask who's talking?
It's Cameron. I hurt my back. Is this telehealth?
Yes, this is telehealth. Can you tell us exactly what the pain is, miss?
It's in my back. Should you take a picture so you can address and see what medication I need?
Yes, it's exactly what we will do. We will do that exactly, and we can figure out what's the problem. So that was a little. That's not how it's gonna be, but we had this interview with telehealth. These nurses, like,
Yeah, it's a new program here in Norristown. It's actually pretty cool. It's something with you take a picture, you can get medication. They'll tell you all in the interview.
I only know so much.
And then, so basically, it's in two parts. There's a lot of information to know. So the first part's this week, and the next part's next week. So you can look forward to that.
Definitely, and y'all can find out and comment in below and subscribe and tell us what y'all think. How this will help our school. Do you think it's gonna help? Do you think it's gonna be beneficial to our students, to the staff? So
Yeah, so let's watch that interview and let us know what you think.
Hi, I'm Maya Humphreys here with Miss Haynes and Miss Gibbons, and today we're talking about digital health program from CHOP. Hello.
Hi.
How are you guys?
Good.
How are you?
I'm good.
Good.
So what is digital health?
Digital health is really looking at technology to understand how we can use technology to improve healthcare, to improve the patient's experience when you go to the doctor or the hospital, to improve the doctor's experience using technology to help treat the patients, and really to address community health needs.
If a student were to become ill in school, how would a diagnostic test work?
That's a great question. So the nurses at the schools, at the 3 schools in this pilot program, have a device in their office, and I think you're going to see that a little bit later in the interview. And the nurses will decide if they need to utilize a CHOP doctor and that equipment to help see the student. The nurses are really great here, so there will be times where they don't need to call a doctor in. They know what to do, and they don't have any questions themselves. But if they do think that they would like a doctor involved, they'll use this device. And if you think about FaceTime on your phone, you're seeing the doctor virtually, so the nurse and the student will see the CHOP doctor. But it's a lot more secure than FaceTime. No one can hack into this software, but it also has these additional tools where you can get temperature, and the nurse and the doctor can listen to your lung sounds, your heart sounds. It's a lot of really cool technology.
Wow.
So it'll help with the diagnostic part of the exam.
Are doctors allowed to prescribe medications?
Yes, they will be in this program. So there are a couple of things they can do. The nurses have some over-the-counter medications like Tylenol and Advil and some creams and so on, that if the doctor says, I'd like you to give one of those to that student, the nurse can do that. Or if you have something that requires a prescription, the doctors can do something that we call e-prescription, and they can basically send a secure fax to your pharmacy, so then your parent or someone can pick it up on the way home. It'll be there when they're driving back from work.
So does insurance cover this?
This program is called Community Benefit, and I think Sarah will talk a little bit more about that. And so we're not charging for this. We're not sending a claim to the insurance company. Families won't get bills. Because it's a pilot and the school and CHOP are learning together as well as families, and we want your feedback, we're making this a free program.
It's great. So how can the doctors get parental consent?
So that's really important, and I'm glad you brought that up, because parents or guardians do have to sign a form to say that they want their student to participate in the program. In addition, there's some other information we're collecting. CHOP has a program or software called an electronic health record, and we have to make sure that the student's information is in that record so that when one of your nurses contacts a doctor, the doctor can see the student's information. So it's a consent they have to sign, but then just some general information about the student. So the school district's going to make that available a couple of ways, and that includes putting it on the 3 schools' websites, and those schools are Gottwald's, East Norriton, and the Norristown High School. They're going to send out some tweets with links, as I understand it, and then the student has to return that signed form and the required information to the school nurse, and after that, CHOP will get that information.
How is this better than other ways of contacting a doctor?
I think it's the convenience. So one of the things that we really want to measure as part of this program, if we can keep you in school, and so you don't have to leave school to go to the doctor, I think that will help a lot. It'll keep your parents at work and it'll keep you in school versus going either just not having time to go to the doctor and maybe you're sick a little bit longer, or going to an emergency room, which we don't want you to do that either if you don't have to. So it's that just in time doctor's visit.
So over to Ms. Gibbons, what are some reasons that you chose Norristown for this?
So CHOP, surprisingly, most people think of CHOP as the hospital, and they think of it as just providing health care at doctor's offices, but CHOP is a charity, and our mission is to improve the lives of children regardless of whether or not they're our patients. So the work that I do in community impact is make sure that we are being good stewards with our expertise in healthcare and providing not just healthcare but also services to improve the health of all children in our region. And so our job is really to look throughout the region to find out where the real big health needs are and make sure that we are doing our part as far as improving those needs. And so Norristown, we know, is a really big area where there's a lot of different health needs. And so we wanted to make sure that we were providing some of our expertise, some of the work that we do at CHOP to benefit the community. And so we have a long relationship with the nurses here in Norristown Area School District. We've worked with them on a number of different projects throughout the years, and we thought that this would be a really great opportunity for us to provide this service based on the great needs in the community.
When does the pilot begin and end?
The pilot begins already, so we're waiting for somebody to submit the consent form, and then of course that student would have to go to the nurse, and there would have to be that need, and it ends at the end of this school year. So I said we're learning a lot. We're hopeful. We're trying to make sure that we can do the program next year. We can't definitely say that will happen yet, but we're really working hard to make sure that that can happen.
Mm-hmm. Is there anything else you'd like to add?
We're really happy to be here.
Yeah, really happy and get those consent forms in.
Yes. I'm Maya here with Ms. Haynes and Ms. Gibbons from CHOP, and we talked about the new digital health program at Norristown. Now over to another interview with Dr. Bonnie Offit.